We are back on Morning Line. Thanks for joining us. Fascinating guest with us this morning. One of the people on the cutting edge of memory study, and that's Dr. Paul Newhouse. He's from over at Vanderbilt Center for Cognitive Medicine. Good to have you on.
Thank you, Nick.
Let's see, we've got a caller that waited through the break, and we'll get into more of the details on some of the study you're looking at here. Let's go to Ann. Ann, good morning.
Good morning.
Hi, Ann.
Hi. I have a lengthy history of lupus, arthritis, and fibromyalgia, and I think I have a good grasp on brain fog, but my family doesn't. How does a person with a history like mine, and my sister struggles with this same problem, distinguish and explain to our families the difference in brain fog and memory loss that occurs to us early in the day and as we're functioning, and memory loss, and the concerns that they have that this is related to fibromyalgia or existing condition or Alzheimer's or conditions of that sort.
All right, Ann, thank you.
Well, that's a fascinating question. And so one of the things we study in the Center for Cognitive Medicine is we look at other disorders in addition to Alzheimer's that might be related to memory loss. And the caller's comment about brain fog, you and I talked about that earlier. We don't know exactly if that's related to Alzheimer's or dementia. We don't think it's quite the same thing, but we are interested in developing better tools to assess cognitive difficulties with things like fibromyalgia and lupus. We know that the immune system affects the brain. It's a two-way street, right? The brain can talk to the body and vice versa. And so we're absolutely very interested in understanding those kinds of conditions better. We don't think it's the same thing as Alzheimer's, but it certainly doesn't help to have that in addition to the risk for dementia or late life. And we're interested in what happens when people who have these conditions get older. Is there going to be an intersection or an enhancement of brain fog as people get age into their senior years?
Okay, so when you're talking about the testing of this, I assume there's some things where someone can sit down and answer questions. I don't know, you give them tests to test their memory function, and then do you also explore their genetic background? If you have parents or relatives that had Alzheimer's, does that mean you're in line to get it too, or is there more of an environmental factor, or does that increase your chances like it does, say, with breast cancer? You got a family member with it, man, you may be on that road as well.
Right. So we certainly are interested in genetics, and it does affect risk overall. Genetics is not destiny, however. And so, except for very rare families, there is no essentially specific gene that will cause Alzheimer's. There are a few rare families in the world that have this genetic cause for Alzheimer's, but that's pretty small. Most of the rest of us, Nick, are at the sort of level of risk of the general population. Okay. But it does tend to run in families, and so there may, and people have looked for a long time for risk factor genes.
All right, and is there right now, as we sit here now, if you or I wanted to go in, is there a genetic test we can take that will tell us if we're going to get Alzheimer's?
Not if you will. There are genetic tests that you can get that will say you have a lower risk or a higher risk, but either one can get Alzheimer's. So even though I've actually had the genetic test myself, and I have the most common genotype in the population. That doesn't mean I can't get Alzheimer's. It just means I'm a little bit lower risk than someone who has the higher risk variant.
And if it meant, let's just say you had the higher risk variant, how would you have reacted to that? Are there things that you start doing if you know that, or is it really something that you can't do much about except follow the normal guidelines of healthy living?
Well, so that's a great question. We're actually starting a new prevention study for people at genetically high risk. So we are actually collaborating with the Banner Neurologic Institute in Phoenix, who is leading a nationwide study to actually take people in their 50s and 60s who have high genetic risk, or higher genetic risk, I should say, and actually offer them a treatment strategy to see if we can cut that risk down.
And is the treatment strategy medicines?
Yes,
or
exactly.
Medicines?
Yeah, up to 9 years of treatment for trying to prevent this illness. Because as we talked about earlier, prevention is really the best strategy.
Absolutely. So would you recommend someone like myself go to get tested like you did to find out if I'm a higher risk, and if I am, should I be proactive on it?
So we are going to be launching this soon. We aren't quite there this week, but we're going to be offering people a chance to get a cheek swab and to get genotyped for whether they're higher risk or not.
Okay, meaning, all right, you'll be, is that as part of a study? Or
That's right. We'll be offering it as, it's also part of what's called the Alzheimer's Prevention Registry. People can do this right now, actually. They don't even have to wait for us. So if they look online for the Alzheimer's Prevention Initiative and the Alzheimer's Prevention Registry through Banner, they can actually sign up for this. My wife actually did this a couple of years ago without even telling me.
Really? Signed up for it, and then you had
And then
to
they swab and they send it in. And, well, they don't necessarily tell you unless you're eligible for a study.
Oh, okay. So if you don't hear anything, then it means
you're probably great.
But if you're there, then you would be eligible for a study where they might try. Is that vitamins? The medicines like what you're looking at now with nicotine?
It's one of these compounds that's thought to actually interfere with these abnormal proteins we talked about earlier, and it's hopefully reducing the deposits of those proteins. Try to prevent them from building up.
From building up.
That's right.
Wow. All right. Let's go to Doretha. Hi, Doretha.
Hello.
Hello, how can we help you, ma'am?
I need to know, is neuropathy, because I'm a diabetic, is that tearing down my nerves where I would have Alzheimer's?
Is that one of the conditions maybe that can lead to some kind of impairment in your brain later? Neuropathy?
Neuropathy. We don't think that neuropathy is directly related to Alzheimer's disease.
Are there any, now let's say you have heart disease or hardening of the arteries or stroke, things like that. Do they play a role?
Well, they certainly are risk factors. So Dr. Angela Jefferson at Vanderbilt is actually studies those heart risk factors and cardiac risk factors, and she believes that those are a significant added burden. We call these an added burden to the brain. So yes, we think that diabetes, heart disease, blood vessel problems, mini strokes, all of that can contribute to memory loss, but it doesn't really cause Alzheimer's disease directly.
Okay, and we should remember there are other types of memory loss that can be a problem for you that is not Alzheimer's related.
That's right.
Okay, so wow, that's interesting. The whole idea of diagnosing it and then treating it and moving forward along those lines. I'm trying to think of some of the other conditions that might come into play for instance, all right, here's a question for you. We talk about heart disease. A lot of people may have high cholesterol. Now, doesn't the brain require a lot of cholesterol or fat? I mean, isn't that part of the building blocks up there? I wonder, with so many people on statin drugs, keeping so absurdly low cholesterol levels, which I understand can be good for you, could that in any way diminish your brain's ability to build itself and stay healthy because the cholesterol levels get so low in your body?
You know, I don't know that that's been looked at specifically, but you may have a new hypothesis here, Nick. But at this point, statins were originally actually shown to actually reduce the risk of Alzheimer's.
That's what I had heard, some of that, yeah. But I'll tell you what.
Although it turns out that if you treat people with Alzheimer's with statins, they don't get any better.
Oh, is that right? Okay.
Yeah. So in other words, treating patients with a prevention strategy doesn't seem to work.
Well, and I can tell you this, I've been on some medicines that actually affected my memory. And I came off them and I was fine. And I can tell you there was a statin drug I was on that affected my memory.
Interesting.
And so I don't know, but there are other things that can affect your memory that you may notice, be it like I was telling you, I maybe had a touch of a flu or something that just made me kind of drowsy-headed. There's a lot of things that can temporarily affect your memory, and then it doesn't mean there's anything wrong.
Exactly. And so one of the things that when we see patients in our memory clinic, one of the things that we do is try to look at their medicines and see, is there anything here that we can eliminate that might improve people's memory. And we do see that occasionally. So it's not often that we can solve the problem that easily, but once in a while we do.
Gotcha. Let's go to Taylor. Hi, Taylor. Good morning.
Good morning, Nick,
Hey.
and good morning to your guest. Interesting subject here, and one that I look at quite often in the different biomedical companies, and there are several that are working on this problem, and for lack of a better word, something that I suppose I could use the word plaque buildup in the brain that helps generate this. So my question is, does your guest have any particular companies that he thinks is doing anything close to a breakthrough?
On treatments?
On treatments, yes.
Yeah. Okay, well, I guess...
Thanks for the show, Nick.
Yeah, you bet, Taylor, and he may have just joined us. Let's go back then to the study, and you said there's the nicotine, and then there's also another substance you're going to be testing as well.
That's right. We've developed a new molecule here at Vanderbilt, a new treatment approach that has never been used before. And we've actually discovered, my colleagues have discovered the molecule here at Vanderbilt, and we've pushed it through the FDA to the point we're allowed to test it in humans, and that's really a first for Vanderbilt and for the United States, for a university group to actually almost act like a pharmaceutical company, to develop a molecule, discover it, and then put it into humans for the first time. We think that that molecule will help the treatment of Alzheimer's disease. We have to prove that, but that's part of what we're doing now. We're actually testing it, its safety in normal people right now as we speak. And there are a number of companies that are trying to develop new treatments. Now, some companies have abandoned this field, unfortunately, because it turns out to be really hard to solve this problem.
Yeah.
And Pfizer actually just announced they were pulling out of Alzheimer's disease a couple of days ago.
Oh, is that right? I missed that. Just because it's just probably not...
They've just decided to invest their money elsewhere, and that's, you know, that's a business decision.
Sure.
And so, but there are plenty of companies that we're working with that are really working hard to develop new treatments, and I think it's kind of an exciting time. I was talking to a reporter yesterday about this. I said, you know, the excitement is really in the smaller companies. That's where the new ideas are being tried. And in a sense, Vanderbilt represents a kind of a small company because we're developing our own drugs here at Vanderbilt, and we're testing them for the first time in humans, and that's an exciting time. Now, eventually, of course, we have to partner these agents because you know, you need deep pockets to do large studies. But we're working with a number of foundations. The Alzheimer's Drug Discovery Foundation is helping us. The Alzheimer's Association has funded part of our work, and the National Institute on Aging is also a very important funder of the kind of research that we're doing to develop these new treatments.
So many people. That's the thing. It's a big deal, and a cure would be huge. Or a treatment that, I guess, at least stops it from happening?
Or slows it down, or prevents it, right?
It's huge. Let's go to Larry. Larry, good morning.
Yeah, this is Larry. I would like to know, how do you get someone in a nursing home that has been diagnosed with this disease? We're having a hard time, and it's hard on us. It keeps running off. So what can we do to get him in a nursing home?
Oh, okay. Well, one thing I've heard, some people have complained that doctors sometimes are loath, for whatever reason, to come right out with an Alzheimer's, you know, that they say this person has Alzheimer's. Okay, and I don't know why that is. Maybe it's difficult to confirm and say one way if that's their diagnosis. I mean, because sometimes you need that diagnosis to qualify for certain monies to put you into certain facilities, and that may be outside your realm.
Right.
But
so, you know, placement of a senior individual into long-term care, into a nursing home situation or a memory unit, is very difficult for families, obviously. And they struggle with this. We help them through this journey through our memory and aging clinic. We're not obviously involved directly in placing people. That's an independent decision, but we can help them with the advice. We can help them with suggestions of different facilities. You know, there's a lot of new memory care facilities sprouting up around Middle Tennessee.
Right.
We can help them. We can also help with the behavioral problems. So if a patient is having behavior problems or behavioral disturbances, we can often use medication to help with that. And we can help with advice and counseling regarding how to manage that person, and then when's the right time to look at long-term care. And not everybody has to go to long-term care. In fact, we work hard to keep patients out of long-term care if we can. But every family's different, and some families can manage things at home and some really can't. And so we have to be flexible and help them do what's best for them.
Let's take a break on that note. When we come back, more phone calls for you,
Sure.
sir. It's an
Thank you.
interesting topic. The number 737-7587. Back with more right after this.